Stomach. Definition of stomach: it is a dilated part of alimentary canal between esophagus and duodenum, acts as a reservoir of food, helps to digest carbohydrates and proteins. Umbilical, left hypochondral usually, and sometimes it also present in left lumbar. Shape of the stomach usually J shape. In living person it is J shape, in a cadaver it is sickle shape. Capacity of stomach is about 1.5 to 2 liters in adult. Length is about 25 centimeters. External features: it presents two orifices. One is cardiac orifice, another one is pyloric orifice. Two ends again, cardiac and pyloric end. Two surfaces, anterior surface, one which present posteriorly, sometimes also called as anterior superior and posterior inferior surface. Two notches are there, cardiac notch, incisura, angularis. Two curvatures, greater curvature and lesser curvature. Two canals are there here, cardiac canal and the pyloric canal. Parts of the stomach, parts of the stomach. Before coming to the parts of stomach, we will see about 3 imaginary planes on which the parts of stomach can be divided easily. So first plane is here, we call it as a imaginary plane 1 at the level of cardiac notch. The second imaginary plane we will draw here from the incisura angularis to the end of this greater curvature bulge. This is a second imaginary plane. And again from incisura angularis to the end of this bulge, third imaginary plane. Now the parts are above to the first imaginary plane, it is fundus. Below to the first imaginary plane to the second imaginary plane, it is body. Between second and third imaginary plane, it is a pyloric antrum, and this one is pyloric canal. Fundus usually contains gas in it, about 50 ml of gas will be there. Body is a reservoir of the food. Pyloric antrum is a funnel shaped and canal is a tube shape. Structure of stomach. It presents 4 layers. The outermost is a serous coat. Serous coat, which is made up of a peritoneum, the layer mesothelial cells of peritoneum. The second coat is muscular coat. Second coat is a muscular coat. It consists of 3 layers. Longitudinal fibers externally, circular at the middle, and oblique at the internal. If you see the structure of a stomach, outermost fibers are longitudinal fibers, second middle layer is a circular fibers, and the oblique fibers internally. And the third one is this much portion, submucous coat. Submucous coat usually consists of loose areolar tissue. Loose areolar tissue. And the last most internal coat is a mucus coat. Mucus coat consists of again 3 parts. A, muscularis, mucosae, lamina propria, surface epithelium. Surface epithelium, it's a honeycomb appearance and presents a gastric pits here. Gastric pits through which the gastric canals are going to open. These are called as gastric glands. Muscularis mucosae consists again 3 layers here, inside, outside and middle. Outer circular or external, middle longitudinal, inner again circular. These muscularis mucosae contraction will squeeze the gastric glands to secrete its contents inside the stomach. Lamina propria consists of a retiform tissue. It's made up of a retiform tissue. And surface epithelium is a epithelial membrane. The folds of mucous surface epithelium through lamina propria of mucus coat will form rugae. Gastric canal, also called as mesenteric. It is a mucus gutter extending from cardiac orifice to the pyloric antrum. Relations. It has visceral relation and peritoneal relation. peritoneal relation. Greater omentum, lower 2/3 of the greater curvature. Lesser omentum along with the lesser curvature of the stomach to the liver. Gastrosplenic ligament. Gastrosplenic ligament from the upper 1/3 of greater curvature to the spleen. Here, spleen. So gastrosplenic ligament. Gastrophrenic ligament. Uppermost part of fundus to the diaphragm. Visceral relation. Anterior surface. Visceral relation on anterior surface. This is liver, diaphragm. Anterior relation. This is the anterior wall relation. Anterior abdominal wall. Anterior abdominal wall. Posterior relations, and it is also called as stomach bed. Left suprarenal gland, spleen, kidney, splenic artery, pancreas, and splenic fracture of the large intestine. The mnemonic to remember this stomach bed is Dr. S3 kills patient mercilessly, where D represents diaphragm. S3 1 2 3 yes. So first S refers for suprarenal splenic artery, splenic artery, and suprarenal. K refers for kidney. Which kidney? Left kidney. P refers for pancreas. M refers for mesocolon. So transverse mesocolon. Blood supply. Main blood supply to stomach is by celiac trunk and its branches. The curvature. This is the left gastric artery, and this is a hepatic artery. Common hepatic artery. Again, it's going to divide into hepatic artery proper and a gastroduodenal artery. So gastroduodenal artery, further after crossing behind the first part of the duodenum, it's going to divide into two branches as a duodeno-pancreatic or superior duodeno-pancreatic artery, and another branch here, the right gastric artery. right gastroepiploic artery, and these are the short gastric artery. So it's supplied by the short gastric arteries, left gastric artery, right gastroepiploic and left gastroepiploic artery. Venous drainage will be followed by the same name, but thing is, left and right gastric vein drains to portal vein, left and right gastroepiploic veins and short gastric veins drains to the splenic vein. Lymphatic drainage. Right two-third portion and left one-third portion, draw an imaginary line on the long axis of the stomach. In right two-third portion, leaving upper two-third portion and lower one-third portion, another division. In left one-third, upper one-third and lower two-third portion. Area 1 drains left gastric nodes. From here it drains to the left gastric nodes. Area 2 drains to the right gastroepiploic node. The right gastroepiploic nodes. From area 2, this will come here. From area 3, they drain to the pancreatico-splenic nodes. These are pancreatico-splenic nodes. From area 3 to here. And area 2 also to these nodes called as pyloric nodes. Nerve supply, they will be by sympathetic, parasympathetic. Parasympathetic, already we know that vagus. Sympathetic is from T6 to T10 segments, spinal segments. Through via, they are going to supply via greater splanchnic nerve, celiac plexus and hepatic plexus. And all these nerves, they will follow the course of artery supply up to the stomach. In applied anatomy, we already know about gastric ulcers, gastric carcinoma, hyperacidity, vagotomy. These are some of the applied anatomy.